Glad to have you back with us here on Daybreak. So National Infertility Awareness Week wraps us this week. Studies show 1 in 8 couples struggle to conceive, and fertility doctors across the country say it's time to normalize it and explore all options. So joining us now is Dr. Julian Escobar from the Conceive Fertility Center in Dallas. Good morning, Dr. Escobar. How are you doing today?
Good morning, Suzanne. Thank you so much for having me.
Absolutely.
Doing great.
Glad to have you on the show. So let's get straight to this topic here, one that affects so many people. What is infertility and how does it affect us?
So, first of all, infertility is a disease. It's not a luxury to have a family and to reproduce. It's a basic human right. It's essential to our species and every species. But people are distracted by the government's stance on it, and also their insurance companies. As it's not covered, it almost makes it sound like it's a luxury to be able to have a family. Medically, we define infertility as a year of trying to conceive. So obviously a heterosexual relationship, right? Mm-hmm. But if you already have issues that may make it more difficult to conceive, you already have infertility. If you're single or if you're in a same-sex relationship, then you have infertility. And as you mentioned before, about 1 in 8, 12% of couples suffer from this. And the services are vastly underutilized in this country compared to other developed nations. About 1.5% of babies are born from fertility treatments. In other countries, it's going to be more like 2 to 4 fold, like 3 to 6%. So there's a lot of room to grow, and basically shows that we need still a lot more work. We have the resources, but the word is not out there. There's multiple factors that prevent people from getting to those fertility services. So less than 50% of patients actually even address that they have fertility issues or where the desires are to grow their family with their medical doctors, their practitioners. And less than 20% ever get treatment. And the sad part is that most people who come see us walk out pregnant with a baby. And when people are afraid of the treatments we offer, 90% of people don't have to do IVF or the advanced stuff. We can get them to conceive just with simple surgeries and simple medications.
Yeah, there are different options out there. And as you mentioned, couples, it takes time to get pregnant. So at what point should a couple see a fertility doctor to get that help?
So a very good question. So obviously, going from the above, if you've tried for a year, you should go see a doctor. If you already know you have a problem, if you're single, if you're in a same-sex relationship, go to a doctor. However, age is the most terrible factor affecting women. So if you're over 35, you should not wait a year. You should go at 6 months. And if you're over 40, you should go at 3 months of trying, not because you have a problem that you know of, but if you wait for the official year diagnosis, you may be losing precious time. So at least you deserve an evaluation.
And that's one of the factors that you're saying puts you at risk for infertility the longer you wait?
Yes, and so let me put it into terms. So the way we define infertility at 1 year is because 85% of couples will conceive in a year. At year number 3, 99. And so the gain is not too much more to wait, right? Mm-hmm. If you're in your 20s, you have the best pregnancy rates. It's about 25% per month when everything is perfect. At age 35 is going to be about 12%. And at age 40 is going to be about 5%. And at age 43, 44, 1% when everything is perfect. So even if you don't have a real problem, if you want to overcome the deficit from age per se, then you would benefit from talking to a fertility doctor, making sure what we have to work with and what options you have so that you are in control of your family building options.
Yeah. And what would you say are some factors that affect access to fertility care?
So location is one. In the DFW, we have amazing fertility practices. So we don't have that problem. But as soon as you start going out of the DFW, there's like little to no services. And so that's going to be one. Obviously, costs. People always equate fertility treatments with a lot of expense, partially because the government doesn't feel that it should be covered and insurance don't cover it. So there's 12 states in the nation that have fertility coverage that is mandated. Where I joined in Illinois, that's how it was. But here in Texas, like most states, there's none. So you're left to what your company gives you, and very few companies are giving you fertility services covered. that is growing incredibly the past couple of years. And I'm
Yeah.
glad they're trying to see that the working population is 25 to 45, and they're not so concerned about their hip replacement. They're concerned about building their families, their dreams, they put them to the
Right.
side. So
And
companies are starting to integrate that, and that's been a huge positive we see. Now, there's systemic discrimination, and let me explain. Still, most patients seeking fertility help are going to be white, um, well-educated, and upper middle class women. And so that creates a little bit of a impact on referral
yeah.
physicians
Hey,
that
Dr.
may,
Escobar, I hate to interrupt you. We're running out of time right here. I know there's
yes,
so much information, helpful information. Where can they go real quick before we had to break?
they can go to any Google fertility doctor. So obviously we have Conceive Fertility Center.
Perfect.
There's many other great practices. That's a great resource. The ASRM is the American Society for Reproductive Medicine. There's also tons of resources there.
Okay, thank you so much for your time. We really appreciate it. We'll be right